Symbiosis of viruses, bacteria, fungi, and parasites. Microorganisms help each other synergistically to help settle, to enhance their metabolism, reproduction, and especially to develop pathological. A virus is a biological entity that does not have its own metabolism. It does not breathe nor excrete. It just reproduces itself, needing for this DNA strands. Viruses consist of a virion of DNA or RNA and a capsid, which is a mucoprotein. The mucoprotein needed by the virus is produced by the bacterium that resonates with it. Therefore, viruses and bacteria support each other in symbiosis. If the virus is DNA, then it is pathogenic. But if it is RNA, then it is structural. It fills spaces but has no pathogenicity and intelligence. RNA viruses weigh more but have no intelligence. They produce a lot of mucus, covering spaces, in addition to resonating with a bacterium. A DNA virus requires that the bacterium that resonates with it is not pathogenic. If the virus is RNA, then it resonates with pathogenic bacteria. The bacterium produces the mucoprotein that will give viability to the virus. Fungi are also unicellular and require 4 elements for their metabolism: organic matter, humidity, lack of sunlight, and acid pH. And viruses provide the acidity needed by fungi to grow. If fungi are present, there must necessarily be a virus that will prepare the biological terrain. When a biomagnetism therapist scans a patient and finds a fungus, he should also look for an associated virus that gives sustenance. If he eliminates the virus, then the fungus will decay alone. This is the only way to proceed with the patient. And this is why antifungal drugs have limited effectiveness. On the other hand, despite what is usually heard, no virus is dangerous in itself. Viruses can only excite the cell, for example mitochondria, causing fever. But when combined with fungi, then they do become dangerous, because fungi have explosive growth that damages the tissue in which they grow. And when associated with bacteria, viruses are also dangerous because bacteria that resonate with them can produce toxins very harmful to the body. And parasites, in turn, need to feed on bacteria. If there are parasites, it is important to look for the bacteria that support them. Eliminating the bacteria may prevent the parasites from continuing to develop. In addition, parasites may in turn be affected by bacteria or viruses and act as reservoirs of bacteria. All this therefore shows the close relationship and collaboration between different types of microorganisms, and this is a change from the mindset of allopathy. Moreover, since biomagnetism is able to detect any internal pH imbalance as soon as it begins to occur, a therapist can eliminate the microorganisms or dysfunctions associated with these imbalances even before they can join in symbiosis with other microorganisms, and therefore before the patient has shown his first symptoms. And therein lies the great preventive value of this therapy.